Thank you. Hello, my name is Rebecca Heck, and today you're here for the Maternal and Child Health FY14 Contracting webinar. Again, thank you for joining us, and by the end of this session you will gain an understanding of the FY14 MCH contractual, fiscal, and program requirements. This is not meant to be a complete or a fully comprehensive list of all your requirements, but we're highlighting some significant requirements and some changes to your requirements. The webinar is divided into 3 sections. The first section is contract. This will be led by Kathy Jacobson, Senior Contract Specialist. The second is by Patricia Nord. She'll address fiscal requirements. She's our MCH Fiscal Officer. And finally, there'll be time for program requirements led by myself, Rebecca Heck, and that's probably the shortest section. And we're all dressed up as our Halloween costumes as contracts, budgets, and the MCH population. So if you have any questions, we'll address all questions after the 3 sections, so after contracting, then after fiscal, and after programming. You can type right there into the chat room with any questions or problems that you're having during the webinar, or you can raise your hand and we'll unmute you so you can speak and ask your questions. And I want to thank Annie Guo for helping us with the technical portion of our webinar today. Yay. Okay, before we start, which Colorado county has one of the busiest post offices in the nation on Valentine's Day? Feel free to type your answer in the chat box. Larimer, great. It's you are correct. It's Loveland, Colorado. So Larimer County. Thank you. Oops. Okay, I'll turn the webinar over to Kathy Jacobson.
Good afternoon, everyone. How are you? I'm Kathy Jacobson, Contract Specialist. My portion is not necessarily the most interesting, but with that out and executed contract, you wouldn't be able to do the wonderful work that you do for the people of Colorado. We appreciate the hard work you do. The things I'm going to cover today very briefly, I'll talk about program roles and responsibilities briefly, contract basics, standard contract language, and a few of the special and additional provisions that appear in your contract. And if this is me and my phone number. However, with regard to your contracts, if you have specific questions about your contracts, or you think you might have changes that are necessary to your scope of work or your action plans during the contract year, we would like you to contact your MCH Generalist and speak with them first. And if they feel that we are going to need a contract change, then they will contact me directly. The overall goal of your work is to improve the health and well-being of the MCH population, including children and youth with special health care needs. And the role of the contractor, which is you, is to develop, implement, and evaluate a comprehensive plan in accordance with state and federal MCH guidelines to improve the health and well-being of the MCH population, which includes children and youth with special health care needs. Some of the basic expectations we have of you with regard to your contract: please read your contract, that's very important. Reference your contract regularly as you're doing your work throughout the year so that you know what is expected of you in terms of contractual agreements. And of course, we're always here to help you if you have any questions throughout the contract year. You'll see here on this slide, these are some of the various federal regulations that are applicable to your contract. I won't go through them all in any detail, but you can reference them online if you're interested in reading any of those. Some of the federal laws that apply to your contract are the Hatch Act, which involves using federal funds for political purposes. Davis-Bacon Act, which has to do mostly with construction contracts. So while that is a federal law that is included in your contract, it may or may not apply to you. And of course, non-discrimination based on race, color, national origin, age, or disability. Again, some more of the federal laws that appear in your contract: Americans with Disability Act. You can't use your federal money to lobby the legislature or a political subdivision in the state. And of course, HIPAA compliance. We won't go into this in any detail at all, but these are some of the annual requirements with regard to audits for agencies receiving federal funds. Some of the standard contract language that appears in your contract, we have a section called Special Provisions, and what these do, these cover things such as the fact that the state controller must approve your contract before you can work. Your contract is contingent upon available funds. It talks about prohibition of software piracy, conflict of interest, and of course, employing individuals who are lawfully present in the U.S. And what additional provisions are, these are provisions that are specific to your grant or your program requirements. The most important special provision is that your contract is not valid until it is signed by the state controller or the state controller's designee. And what happens, as you know, is that you will receive notification from the contracting unit when your contract has been executed, and we'll notify you as to what date you can begin working. And as far as the financial obligation of the state beyond the current contracting year is always contingent upon availability of funds. Some of the more special provisions we have in your contract, we identify that each contractor with whom we do business, they are working as an independent contractor and not a state employee. And of course, you'll also apply with or comply with all applicable federal and state laws, rules, and regulations. This one here on the screen has to do with computer software. Of course, you're not going to buy counterfeit software. We don't allow that. And also, with regard to the conflict of interest, you're not allowed to work in any way that would conflict with current state or federal laws, and you cannot employ anybody who also has a conflict of interest. And this one is an interesting provision. It doesn't necessarily apply to MCH contractors. It talks about how we can retain your money if you have unpaid student loans or unpaid child support. And this particular provision here talks about how you must hire people who are lawfully present in the U.S. and they must be able to document their lawful presence. One of the new things we added this year in your contracts is the use of a grant funding change letter, which is what we call a unilateral commitment document. And basically what that means is if you have no changes to your scope of work or your action plans, we can add or decrease money in your contract using this grant fund change letter, and it is far simpler than an amendment. So if for some reason the MCH program was suddenly blessed with a great deal of extra money, we could use the grant funding change letter to just give you that money without it being a big problem. So these are basically this summarizes my presentation, and I didn't know if there were any questions related to the contracts. You can type them in the chat box. Nope, I don't see any.
No questions.
Wonderful. Thank you very much. I appreciate it.
Thanks, Kathy. So before we move on to fiscal, we have another pop quiz. The world's largest flat top mountain is found in which Colorado County? A Tri-County area, Logan, Mesa, or Route? You can type your answer in the chat box. The first winner gets a prize. Great job. Who's that? Lisa. If you were here, I would give you a prize. But you're not here. It's Grand Mesa in Mesa County. Oh, you're new, so welcome to the MCH team. We're glad to have you. Oh. Okay, Patricia's going to take over the fiscal orientation. So welcome, my name is Patricia Nord. I am the new fiscal officer for the Maternal Child Health Block Grant and your fiscal officer for your grant. And I'm happy to be a part of the team. So for today, we're really going to focus on some of the big changes that you'll see in your contract for the fiscal guidelines. And so we're going to highlight our communication and contact, invoicing process, allowable food costs, the budget revision process, what type of monitoring we will be doing, and then resources for you that are online and us as well. So first we're going to go through fiscal communication. So any incoming information, which would be your updates that you have, things that have changed as far as personnel, or if you do have a budget revision request, you're going to send that email or contact your MCH Generalist consultant. That'll either be Julie, Cassie, or Rebecca, and you all should know who you're assigned to based on your county. If you have an invoice you need to submit, that should go to the MCH mailbox, and the web address, the email address for that is on your screen there on the slide. That is not a change, so it's the same as what you've always been doing, but just a reminder, it will still continue to go there. And then I'm your fiscal contact, and I will be most often sending you emails. So I'll contact you with questions or discrepancies I may have on your invoice that I don't quite understand something, or it's a little bit different than what you have in your budget. And then I will also let you know if you did submit a budget revision that it has been approved and the date it's been approved, and give you your new revised budget. And the last two bullets is my telephone number and my email. You can always contact me if you have specific questions or concerns, but we do ask that you use the Generalist as your first line of defense so that way we can all stay in the loop. So next we're going to look at something new that you all should have received from me is your invoice templates. So what we started doing is customizing templates that match the budget that you submitted to us, so it aligns with your contract. And what we're hoping this will achieve is to expedite processing, because when we're reviewing your invoice, it will match up with your budget and we can review it quicker. And it should also reduce errors, since all the information matches up. You don't have to go look back and forth or make sure to see if how something was put in your budget, since you did it so long ago, it's hard to remember. Also in the template, you'll see in some categories the term nothing budgeted, and that just means you did not ask for any money in your budget from CDPHE. You may have had something in there as in-kind, but if you didn't ask for any money from us, we are considering that you did not budget any money to receive from us. If you do need to add an item to this category that you decide, oh, you know what, I didn't have any travel budgeted, but I do need to do some travel, you will have to do a prior authorization, a budget revision request to open that line and make the purchase. You cannot have any expenses on a closed line until you get approval. So it's really important to think ahead if you're going to be doing some travel that you get authorization before you do the travel or before you make the purchase for a computer or whatever it is that you need to do. As far as modifying the template, if you have something that you need to add, you forgot that, oh yeah, we do need to buy a new computer and we didn't have that in our operating, we just had general supplies, just add an explanation for us so we understand why you needed to purchase that item, or add that personnel staff, so that way we have an understanding and we don't have to hold up your payment. If it doesn't match with your budget, then we may have to come back to you and ask questions. Well, what is this person for, or what is this item for? And we want to expedite your payment as much as possible and keep things moving forward. So next I'm going to go through just some invoice reminders, and these are kind of within our division some of the commonly missed items that we see. So it's not necessarily something you do, it's just something we see in general that a lot of agencies may miss. So the invoice number, it must be unique. It can't be the same as another invoice number you have when we enter it into our database. If it is duplicative of any other invoice you have, even if it's with a different program, it will spit it back out. So it's really important to make sure it's unique. We also ask that you reference the population number, so the population in the number, and that would be care coordination or medical home, specialty clinics, and that just helps us know which population you are submitting your invoice for. The last item with your invoice number is it's limited to 12 characters, and this includes spaces, so you don't have a whole lot to work with when you're putting that invoice number in. But again, if you put something longer than 12 characters, our accounting system won't accept it, and we'd have to stop our process and come back to you and ask you for a new number that's 12 or less. The invoice period must be updated for each invoice. It doesn't auto-populate like some of the other fields do, so it's important to remember to update that field at the top of your invoice. Also, the address that you put in, that is the address where you want your payment mailed. So this address may be different from where your program sits. So it's important to make sure that you have the address where you want the payment mailed. Now, if you have electronic funds transfer set up, then it doesn't matter, but it's really important that you make sure the mailing address is where the payment goes, not where you may be located. Some additional reminders, the other category in the invoice template, please do not use it. It's not a category in your budget. We are actually using a department template for the invoice template, and we cannot make any changes to that. So we're kind of stuck with having that other category even though we don't have it in our budgets. So please do not use that. Follow your template that I sent you. And if you have something that you think would go in the other category, it probably goes in operating. When you're looking at your expenditures, there's 4 main things you want to think about when you're deciding if you can put that charge towards this grant. And these are concepts that come from the federal level. First of all, is the expenditure allowable under federal guidelines? For example, if you wanted to buy alcohol, well, federal guidelines do not allow you to buy alcohol, so you couldn't put that expenditure on there. The next thing you need to look at, is it allowable to this grant and scope of work? So does this grant in your contract provisions and in your scope allow you to make that purchase? The next question you want to ask yourself, is this reasonable, or do a prudent person test? So one example, we get people that ask us if they can buy food for their doctors for the clinics, and you want to ask yourself, well, is that reasonable, or would a prudent person do that? Or the next bullet, is it really necessary for you to get the work done? Well, no, it really isn't, so then you shouldn't buy it or put it on your invoice. And then the last bullet is it necessary to complete the scope of work for the project? So do you need this purchase to complete your scope of work and keep the project moving forward? The next item to talk about is the match and in-kind column. On your invoices, you do not include match or in-kind. Again, this is the department's invoice, so we can't take that column out. So we ask that you please do not put anything in that column. If you were to include something in that column, that requires additional monitoring that we have to do
that the grant does not require us to do. So that's just extra work on our end and extra work on your end. When you put match in that column, we have to look at it as if you were actually billing us as far as monitoring and looking at the records. So we don't want to create any extra burden on either of our parts, so we ask that you just don't put anything in there. Invoice submission, we have a new due date, so this is changed from previous. It used to be 60 days, and now it is 45 calendar days. And this is to align with our state rules that we have to have things processed within 45 calendar days. So we are passing that on to you. One key point to remember is that this is effective for services provided after October 1st. So if you haven't submitted your September invoice yet, then you could still have this full 60 days. Submission, you should submit a signed invoice, so make sure whoever your authorized person has signed it. And then also include the reimbursement details page, because that gives us all the detailed information so we know what you spent your money on. And then again, you submit the invoice to the MCH mailbox, and again, that email address hasn't changed from the past, but you do want to send it there. Don't send it to me. Don't send it to the Generalist. Send it to the MCH mailbox. I'm going to touch upon food. This is an additional provision in your contract. It should be additional provision number 9 or around there. And what you can buy for food is food used for events related to your MCH action plan. So that could be trainings, community meetings, external stakeholder engagement events, or multi-county regional meetings. What's not allowed is food for routine staff meetings or the specialty clinics. But please keep in mind that giving you that reasonableness test, is this a reasonable cost for us to conduct the meetings to get good attendance? So don't get too extravagant. It should be just whatever you need to get the attendance you need for your meetings. The next item we're going to talk about is budget revisions. We've had some updates with budget revisions. We're working on aligning our process with the federal process. And with that, we do not need budget updates. They're no longer required. So you don't have to worry about providing us those updates anymore. We'll get into a little bit of keeping the communication channels open, but as far as the budget update formal process, that's no longer required. So first you want to look at if you need to do a budget revision. When you're assessing, you need to move some money around. First of all, you need to make sure there are not going to be any changes in your overall total budget. If you need to make a change in your overall total budget, we'd have to do that grant fund change letter that Kathy talked about, or an amendment to your contract. You should also not have any changes in your scope of work. So if you're changing what people are doing and it affects the money as well, or again, we'd have to do something bigger such as an amendment to your contract if you're going to have to change your scope of work. The other thing with budget revisions, and this next sentence is a long one, so I might read it twice. You're moving funds from one budget category, so that would be like personnel or operating, or one budget, like your care coordination budget, your medical home budget, specialty clinics budget, to another. It has to be in excess of 25% of your total direct costs of the contract, or more than $250,000. So the $250,000 will only impact those who have over $1 million contract with direct costs. So most of you are under that threshold. So you really want to focus on the 25%. And again, it's 25% of the total direct costs. So this is all of your budgets combined to give you the total that you amount that you have in your amendment minus your indirect. And we are going to have some examples to show you, so It will hopefully make it a little clearer. If you're moving funds between or within one budget category, so say you need to give more money to your fiscal administrator and take some away from the program staff, you can do that without worrying about a budget revision because it's within the same category in the same budget. The next bullet is if you are adding any funds to a budget category that has no CDPHE money on it, you have to do a budget revision. So that goes back to when I was talking to you earlier on your template. If it says nothing budgeted and you need to put something in there, you need to do a budget revision first before you can incur the cost and then bill us for it. So more information on budget revisions. So if you're moving less than 25% of your total contract budget of direct costs, or $250,000 to all those open lines, you don't need an approval request. It's not required. All we ask is that you send your MCH Generalist consultant an email informing them of what you're going to move. It's just an informational email. We're not going to make any changes to your budget or do any changes. We're just going to take that as an informational correspondence. So we are not going to do any approvals. So it's a one-sided conversation. You're just letting us know, and we're going to say thank you for letting us know. There's no approval that you're going to have. One thing to keep in mind, however, is any changes that you make below that 25% are cumulative. So if you move 5% in 1 month and then another 20% the next month, it accumulates up until you go above the 25% threshold. So it's really important that you're keeping track of where you're moving things in relationship to your original budget. If you are going to move more than 25% of your budget, or over $250,000, or moving any money to a closed line, you must do a budget revision. So to do that, first you want to contact your Generalist consultant and complete a budget revision request form. And those budget revision forms are on the MCH website, and I'll show you what they look like here in a little bit. Then you can complete that and submit it to the MCH Generalist consultant. They will review it. They'll send it to me. I will review it, and then I will send you notification that it's been approved, and you can go forth and do your good work. The budget revision resets your budget. So this is like your new budget, like the other one didn't exist past this date. The changes are not retroactive. So if you incurred a cost that was December 15th, but your revision wasn't approved until December 30th, you can't ask for reimbursement for it because it happened before the revision was approved. The deadline to submit budget revision forms is June 30th. So mark that on your calendar. You can't submit any budget revisions after June 30th. So we're going to go through a couple of examples to help illustrate what the budget revisions look like in practice. So our first example is that you have a total contract budget of $60,000, and you take out your indirect costs. So your total direct costs are $50,000, and that's broken out between, you have 3 different budgets for your populations that it's broken out into. So your first revision in December, you decide you need to move $6,000 from operating to personnel within your medical home budget, but you have no changes in your scope of work. So we're going to think about, would that require a budget revision or not? So your total direct costs are $50,000. 25% of that amount is $12,500, and that's just to move around to your open lines, and you need to move $6,000. So that's less than $12,500, so you don't need to do an approval request. You would just submit your FYI email to the generalist and move the money. So the second example, we're still working with the same budget, but we decide we need to move more money. We did our first revision of $6,000, but oh, we got to move some more money in March. And we need to move $10,000 from personnel in the medical home budget to personnel in the child and adolescent budget. You will have no change in your scope of work, and again, that's important because if you change your scope of work, we have to do a different process. So really make sure you think about that when you're moving the funds around. So for this one, you had a $6,000 revision in December, and now you're going to move another 10, so that gets you to $16,000 that you will have moved cumulatively, but you're only allowed $12,500. So you do need to complete a budget revision request before you can move that $10,000 in personnel or charge any personnel to that new line in your child and adolescent budget. And again, this is because it's greater than 25% of your total direct contract costs. Once the budget revision is approved, this resets your budget. So that's your new budget to work with. If you needed to do another revision after that, it would be based on this new approved budget. You wouldn't look at your original one because then you'd be doing budget revisions every time because you hit the 25%. So this resets everything. You start from zero, and then if you have to make more revisions, it would add up after that. So before I go into monitoring, I wanted to show you, see if I can get to the right thing here, show you the budget revision templates. So this template is the budget revision if you're going to move money in one budget. So that first example where they moved $6,000 from one category to the next, even though that example wouldn't apply for the budget revision, if you're moving money from your operating to personnel within your medical home budget, and that's it, you're not moving between budgets, you'd use this template. And you can see here, you need to put everything in your original budget. Even if you're not going to revise or move that money, you still need to put everything in your original budget that you had. And that will make it nice with the templates I supplied. You can just use that copy and paste it over, because those all follow your original budget. And then you can put the revised amount. The variance column at the very bottom should always equal 0. And that's just to tell us that your budget didn't change. What you increased or decreased for any of those items, it comes out in the wash to 0. So if you're not at 0, keep fiddling with your numbers. You gotta get to 0, or we're going to spit it back. The next template is if you need to move between budget categories. So if you need to move money from your child and adolescent to your medical home, you would use this template, and it says multiple budget revisions. And there's several tabs on this one. Your instructions, then you have the combined budget revision form, and you'll see at the top this auto-populates, so that you don't need to fill out anything in here. It will automatically update when you fill out the other pieces. So first you go to the budget revision form A, and that would be for whichever population you need to make a revision. Complete that information, and then you go to the next one to tell us what the next population that you need to change or move money around. And you do that for however many budgets that you need to move. But you don't need to do it for all of them if you're not moving money among all of them. So if you're only moving money between 2 different budgets, you only need to fill out 2. If it's 3 budgets, then you need to fill out 3. And then all of that information will be populated in the combined form. And again, the combined forms of variance should equal 0 again, because again, whatever you're taking out from one budget and increasing in another should come out to 0. There's also at the end of the template samples, so if you're still confused, you can look at the samples and see how everything ties together to make sure you're filling yours out right. And you always have us to call and talk to if you're still confused and you want to make sure you're doing it right. You can email us or call us, and we'll be happy to help you as well. So next I'm going to talk a little bit about monitoring. First, source documentation requests. We will only be asking for source documentation for those that are under the financial risk management system with the department if we have question costs. So if something doesn't look right and we need to see the backup documentation that supports that cost, we will ask for that. Also for routine review. So if you're not on the financial risk management system, we have routine review that we do based on your risk assessment, and that we would request the source documentation based on that timeline that we have for your based on your risk. The last bullet, please do not submit source documentation unless we ask. We're just going to throw it away, and we don't want to waste paper or waste your time and energy submitting information that we don't need or don't need to use. So please save yourself the effort. We also may conduct fiscal desk reviews or site visits, but we would only conduct those as needed if problems or concerns arise. So this grant does not require us to do fiscal site visits, so we would only do it on an as-need basis. And finally, we have our online resources for you, so you can always go to the MCH website and you can find our budget revision templates and the invoice example sample. And we are updating the invoice sample, so a newly fresh one will be up there for you probably in the next week or so for you to look at if you want to see how to properly fill one out or want to make sure you're filling yours out correctly. And then if you need direct assistance from me, you can email me or send me a phone call, leave me a message. I'll be happy to help you with your fiscal needs. Are there any questions with all that wonderful information? I'm sure somebody has to have a question.
Any questions? Any questions, Carla? Okay. So, oops. We can't forget the last pop quiz. Which Colorado county lays claim to the invention of the cheeseburger? Anyone? A, Boulder. We can eliminate that one because it's a cheeseburger. I live there, so I can say that. Yeah, they have a black bean burger. B, El Paso, C, Pueblo, D, Denver. Okay, the answer is Denver. They take credit for inventing the cheeseburger.
Now a couple came to
Oh.
who said Pueblo and then also said, oh.
Oh, yeah. It is Denver. Fun facts. Okay, so my name is Rebecca Heck. I'm one of the MCH Generalist consultants, and I have a few slides on the program orientation. You all know this very well. So again, these are just highlights of some program requirements. You can see under these 5 bullet points, this is what I'll be covering. You all know our usual program requirements include the submission of action plans, budgets, invoices, and annual reports. I'm not going to go into any of those details. We're just going to jump right into some news about action plans and budgets. Just like Patricia said, there is no such thing as a formal budget update anymore. It's the budget revision process, which she went into. But what we do require and request is that you notify your MCH Generalist consultant via email when there are significant changes to your MCH action plan or budget. And again, this is outside the scope of the budget revision process. These changes include changes in staffing, vacancies, new hires, when you eliminate a job position or add a job position, changes in your action plan objectives or activities, changes that affect your MCH activities or plans that are going on in your community, and any community development plans that impact your MCH plans. For instance, there may be a change in the county commissioner's election, or increased funding to your health department, or decreased funding, and all those things could impact your MCH plan. So we request an email. This language is in your additional provisions and your scope of work. The sooner the communication, the better to your generalist. However, the requirement is within 15 business days of these changes. We've been talking a little bit about scope of work changes, and that's a big change. That's beyond an FYI email. A scope of work change requires a contract amendment, and this includes when you completely add or delete an action plan. So if you're working on team motor vehicle in FY14 and you decide that you're no longer going to work on team motor vehicle, you're eliminating that entire action plan, you need to contact your generalist consultant as soon as possible, and we need to start the contract amendment process, which could take 6 to 8 weeks at least. So the deadline for that is May 30th, 2014. As you well know, one of our requirements are the MCH Progress Check-in meetings. These are designed for the consultant to reach out to the local public health agency and check in on the implementation of the plans and budgets. The general consultant will consult with program specialists here and the HCP consultant. Sometimes those folks will join us, and sometimes they'll join us over the phone. But we always share news from our LPHA partners back to the HCP team here and our MCH implementation team leads. The format and content varies throughout the year, and usually it covers multiple fiscal years. So for instance, we're holding some check-ins in October, November, where we're wrapping up FY13 news, and we're also talking about FY14. And so your general consultant, Kathy, Julie, or myself, Rebecca, contact you to schedule these in October, November, January, and April, May. And just April, May, we'll cover FY14, but we'll also definitely start planning for FY15. Another point that we wanted to review with you is the Contract Management System rating. We call these CMS ratings for short. You receive an email from your MCH Generalist Consultant 3 times a year in October, November, February, and June. And this does reflect your contract performance. As a Generalist Consultant, I consult with Fiscal, HCP, the MCH implementation team leads, and other MCH-related staff to come up with the contract performance ratings. You can read the categories there, and this scale is above standard, standard, or below standard. Here are the contacts of our consultants, including MCH and HCP, and the contacts of our unit managers for MCH and HCP. Gina's last day as the MCH unit manager is December 13th of this year, but she will probably be back in a consulting position early next year to help with the MCH needs assessment process. And then finally, please reference mchcolorado.org. We just posted today the updated FY14 guidelines, and I highlight in yellow any changes, so you can just scroll through the 50-page document until you see the highlights in yellow, and that's where you'll see information about the budget revision process. Like Patricia said, we're going to post a new invoice example, so you have that to reference. And today we will also post the new budget revision forms. Those are the 2 templates that Patricia just went over. Additionally, we will post this recorded webinar and the slides from this webinar for future reference and new staff. Are there any questions? No?
Before everyone signs off, this is Gina Fabraro, and I'd just like to thank Rebecca, Trish, and Kathy for presenting today and sharing all this important information with you. We're so grateful you're all a part of our team, and thank you to all of you out in the communities for doing all of the great work that you do.
Angie did have a comment. She says, nice job, ladies. Very easy to hear, follow, good slides, and the pop quizzes were fun.
Thanks, Angie. Thank you, Angie.
And then Kelly here said thank you.
Well, thanks for joining us today. If you had any colleagues that listened to the webinar on Monday, you could refer them to this webinar that we'll post on the website. We had a few glitches on Monday. So we appreciate your time, and feel free to email us if you have any questions. Thank you.